and thank you as always for joining us for the lunchtime COVID-19 community messaging update. So even though we still call it the COVID-19 update, we actually have fewer. Recently, we haven't had quite as many COVID updates, and so hope you're okay with we've sort of included some other things going on kind of in the public health world that we hope will be interesting. But we will start with COVID. And again, it has been a roller coaster on the COVID counts. This is the community levels. It's been interestingly kind of that far northwest corner that has been relatively orange. But if you look at the whole state, I mean, the counties just kind of keep turning colors, I guess. But if you look at the whole United States, definitely the map is trending towards orange again. And that was after a couple of weeks of looking like it was going more yellow and green. The reason for that is the BA.5 variant. So we'll talk about that in just a minute. Here's the community transmission. Again, it's just two different ways of measuring the amount of COVID in the community. But, and this one is just looking at case counts, not hospitalizations. So we continue to have that situation where case counts are really very high, and we don't even, we know some of the who has COVID, but there's a lot of people testing at home, and they are not included in these counts. So case counts are high, but hospitalizations still are not as high as they have been in the past. And that's again because people are vaccinated, or they've had it, or they're getting oral medications or treatments for COVID. So we just have more tools for fighting Omicron. So the current variants are, basically offspring, children of Omicron. And BA.5 is the one that's currently marching across the country. So in our region, which includes Texas and New Mexico and Louisiana, Oklahoma, and I always forget Alaska, but they're part of our region too. We're at almost 70% of the cases are BA.5. That doesn't always mean it's exactly the same in New Mexico, but within a week or so, our cases usually catch up. So, and BA.5 is again very it transmits very easily. And again, so far, it does not seem to have made hospitalization rates skyrocket, but also across the country, we're starting to see hospitalizations go up. So vaccine updates, Novavax, which I just laugh because I feel like I've been talking about Novavax for, it keeps almost getting approved, and then somehow it doesn't. But it has been approved in many places in the world. It's had a little bit of a rocky road through the United States approval process, and that's mostly because they've had trouble manufacturing it. They've had trouble being able to actually crank out a good supply. But that seems to have all settled down. It got the blessing from the subcommittee, from FDA, from the ACIP, which is the vaccine committee of the CDC, and from the CDC. So it's cleared all the hurdles. And there's actually a lot of experience with this vaccine in other countries. So that's kind of cool. We probably won't, we don't have any in the state right now. And we probably, maybe a week or two before we get it, and we won't have a lot of doses. But it is an interesting, depending, I guess for people who haven't gotten vaccinated, it may be worth bringing up the conversation with them around this vaccine. It is also a 2-dose series and given up 3 weeks apart. Novavax works differently. It's not an mRNA vaccine. So for people who are just scared about mRNA, this might be a good vaccine to talk with them about. And it's also not the same as the J&J and the AstraZeneca. It really is kind of basically the whole particle, rather than being kind of assembled in the body, is assembled outside the body and gets, you know, injected as part of the vaccine, and that's what your body responds to. And that's kind of more typical of other immunizations that we have. So basically, it's a very interesting process, how, like, many steps to making it, but they basically assemble these little nanoparticles that are just the spike protein of the COVID vaccine, kind of the spikes all stuck together. That's kind of what's getting injected. Your body sees it and goes, "Oop, don't like that. I'm going to make a lot of antibodies." And then, you know, when and if you actually get exposed to COVID, your body, all of those antibodies are ready to go, and because they recognize the spike protein. So
Miranda, can I interrupt you for 1 second?
Sure.
I'm so sorry. Walter is here, so if you need translation, it's now available. Just click the globe on the bottom, and it will be available in Spanish. So you can keep going, Miranda. Sorry about that.
Okay, yeah, no problem. And if there's questions that like came up, because you know, on the slides, we can go back at the end. Okay, so the Biden administration bought 3.2 million doses of the Novavax vaccine. That sounds like a lot, but we've given at least that many just doses of vaccine in our state alone. So again, this is going to be a small number of doses coming. So it might take a little bit of work for someone who really feels strongly about this to match up with a provider who has it. And again, I always refer people to our call center as a really good resource for helping navigate that. And once approved by the CDC, so yesterday the ACIP, which is basically the CDC, did sign off. I actually am not sure if the CDC director signed, but usually she does right after the ACIP signs off. So let's see, fall boosters. So this is also the FDA advisors basically over the summer have met a couple of times and discussed, like, should we have a booster in the fall that's different than what we've been getting so far? And the answer they decided is yes. And again, there's that argument, people say, well, how will we know? In the fall, it might be something totally different than Omicron. That could be true, but all the most recent variants have been, again, children of the original Omicron. So I guess they're hopeful that, you know, that will be relevant in the fall. And otherwise, we just don't have any way to know, like, you know, what might happen. So these boosters, you know, I think October is probably the soonest that we can possibly expect it, because, you know, the idea just got approved and now, you know, they have to go into production on them. They will be bivalent boosters, and that means they have two different strains, the original COVID and the Omicron strain. And this is very much like flu. Like every year they decide which flu strains should be in the flu shot. There's usually 2 or 3. Or sometimes even 4 different ones goes into the flu shot, and that's what we have for the year. So it's kind of a familiar model. It's just that COVID is very new. And the other thing is, you know, they do keep working on trying to have longer lasting immunity from the vaccine, because again, we do know it works really well, but immunity does wane over the months after you've gotten the vaccine. So hopefully it would be nice if we had something that actually lasted for a whole year. Okay, so switching gears quickly to monkeypox. I think since the last time we met, we did have our first case in New Mexico of monkeypox, and I think our case count is 6 at this current time. Across the United States, there's 2,000 cases reported, so the numbers do keep climbing up. Again, still a pretty rare, I mean, you know, it's popped up on the map turned blue, everyone has a case, it's a little bit scary, but overall, it's still a rare disease, especially when you compare it to something like COVID that, you know, just so many people are catching COVID these days. So the monkeypox symptoms usually start within 21 days of being exposed. It often starts as a flu-like symptom, and then people get the little pox that you can see in the picture. But sometimes what they've been noticing about the current US outbreak is it doesn't always start with the flu symptoms. Sometimes it starts with the rash, and then people get kind of the tired and feel achy and sometimes have a fever. The monkeypox can spread from the time the symptoms first start until the rash is fully healed. So these lesions do scab over, and then when the scab falls off and there's kind of fresh layer of skin, so not an open wound, that's when they're no longer infectious. So it can be a long haul, 3 weeks of waiting for these to heal. So in order to avoid getting monkeypox, the main thing is you want to avoid skin-to-skin contact with people who have the rash that looks like monkeypox. And, in general, it's probably good practice to be careful when people have rashes, just not to touch without gloves. Also, you want to avoid hugging, kissing, cuddling, or having sex with someone with monkeypox. These are all things that just bring you into close contact with someone. There is some, from prior monkeypox outbreaks and experience in Africa, definitely saliva can carry the monkeypox virus. So you want to avoid sharing utensils or cups or, and, again, kissing's kind of in that group. Avoid exchanging saliva. And then it can also, the virus can live for a while on bedding, towels, and clothing. So certainly if you have someone in the household who has monkeypox, you want to make sure that all that stays separate from the rest of the household. You wash your hands often with soap and water or use an alcohol-based hand sanitizer. Overall, it's not nearly as contagious as COVID is. But I think because you guys all are in healthcare and people might be like, hey, look at this. You definitely just don't want to touch something you don't know what it is without gloves on. And, so you just like, thank you, and go see your healthcare provider. The other thing I'll just say while I'm thinking about it is people who are concerned about having monkeypox can call our COVID hotline, and there are nurses on there. The call will be routed to nurses to talk them through whether it seems like it is monkeypox and how to get seen by a provider. And some people are just kind of worried, they have bug bites, but they're just not sure, and the nurses can talk with them about that as well. So that's our number that we've had all through the COVID pandemic. So the 855-600-3453. Okay, we do have a vaccine for monkeypox, which is kind of amazing. It's 2 doses given 4 weeks apart. It's approved for people 18 and over. And right now we have such a small supply that we are only giving it to people who are actually contacts to monkeypox. So, if we've had a couple healthcare workers who didn't know that someone had monkeypox, was in the room, trying to figure out what this rash is. Again, it's not high risk, but they have been eligible to get this vaccine. So hopefully as we get more vaccine, we'll be able to offer it to, it'll still be high risk people. And the high risk people for this current outbreak so far has largely been in the community of men who have sex with men, or people who have many sexual partners. So that's kind of where the vaccine will be targeted initially. So not everyone needs to be vaccinated for monkeypox at this time, but the people who may be vaccinated are right now people who are exposed to monkeypox, and then people who are working in labs handling monkeypox specimens. And we do have a New Mexico Department of Health website on monkeypox that we'll add to as more information comes. It does link to the CDC, which also, continues to add information to their website. And then this is a handout that is on the website made by some of the people. It's basically based on the CDC handout, but made by people on the Department of Health communications and monkeypox team, and that's available if people want just a kind of one general resource for patients. So, okay, COVID resources. We also, and this is largely thanks to Liesl and Ali and our RTS team, have a long COVID webpage because we're having a lot of questions about that. So check that out. And there are resources there. There's also some promotional information on the kids vaccine. So the under 5 group, you know, not a lot of people are getting vaccinated. We would really love to see that number come up. And still we have a lot of 5 to 11-year-olds who haven't been vaccinated. And with, you know, that's another group. They're going to be going back to school. It would really be great for them to get vaccinated. So anyway, there's a toolkit to sort of help promote that. Other cool things that are happening really across the country, but the 988 mental health crisis line. So the idea of this was like, everyone knows 911. We're going to make one number, no matter where you are in the United States, that you can call and reach a mental health person to help if you're in crisis. So that's the 988 number. It's why we all need to dial like the area code when we're calling within New Mexico, but I think it's well worth it because I think this will be really helpful for people. And it goes to a local, you know, basically a local group that are of behavioral health people answering the line. If that line gets overwhelmed, it rolls over to other call lines that are connected nationally. The Agora Crisis Center is one of them here in New Mexico. And then if that is overwhelmed with calls, then it goes to another national call center. So really the goal is to not have people wait a long time on this line or have to get a call back. There's also 3 options when you do call 988. So there is a veterans crisis line, which is really, you know, focuses on people who are veterans, and then a Spanish line as well. And then the third one is just the for everybody else. And that is 24/7. So there's a media toolkit available, and there's also specific resources for the Native American community and the LGBTQIA community. And whoop, no. So yeah, you know, I always recommend with these things, just try calling it so you really can counsel people well, like, okay, this is the experience when you're on. I mean, you don't want to take up a lot of time for people on the line, but I do think it's helpful to kind of really know what it is that you're talking to people about. Okay, on to our early childhood education and care department, so ECECD, and they have released videos that walk families through the steps on how to apply for free childcare, early intervention services, and home visiting services. And these videos are available in English, Spanish, Vietnamese, and coming soon, Dene. So check those out as well. And that's it for today. So thank you so much for your time. I'm going to stop sharing and see if people have any questions.
So your first question, Miranda, is there a protocol we need to be aware of regarding washing clothing that got in contact with somebody presenting monkeypox?
Yeah, it's actually not that hard to kill. It's just you don't want to, like, what we've been recommending is just do the wash separately, but that's mostly so that if let's say someone in my household has monkeypox and I go to do their laundry, then I'm potentially exposing myself, like through their sheets and clothes, to the monkeypox, even if I'm not in direct contact with them. So you don't have to do anything special. I would just say have that person kind of put their own laundry in and do their own wash, but it doesn't need like bleaching or like, you know, sometimes trying to get rid of like scabies is actually harder than getting rid of monkeypox. Does that answer the question?
Yes, and I asked a question. So when the person used the washing machine, so it's a potential contamination, right? So we need to disinfect the machine, or I was talking more about that. And if they clean, they wash the clothes separately. It's not a risk of anything residue will stay in the machine, and then we wash the clothes, then we'll get in contact with the virus.
Yeah, it's a good question. It doesn't seem to kind of survive in that environment. So as long as it's kind of run and done the whole like cycle and out, um, I think I'm having a little hard time hearing you, but I think the question was like, do you have to do some like bleach the machine itself? And it does not, that's not in the guidance. Yeah.
Okay.
And in the clinic, it's I mean, on the CDC website, you can actually go and check if whatever cleaner you're using in a clinic kills monkeypox. But it doesn't, it's nothing too like the one we use here at Midtown did do it. And it's just, you have to spray it down and then kind of wait 2 minutes. And, we are probably often like a little bit quick to wipe it down, but we've been trying to be good about the 2 minutes when we're worried about monkeypox.
I answered that question because in COVID everybody was using Clorox and this and that, and it's a potential that everybody will start doing the same, so we can guide the community better in this case. Thank you.
Thank you,
Yeah, I think
Fabiola.
a lot of the calls we get are actually people that really don't have any risk for monkeypox. But I mean, it's good to be aware of. And of the people in New Mexico, most people have a travel history, acquired it out of state, came back, started to feel sick, and are in the state now. But not, and I'm sure it'll happen at some point, but no one that's kind of just gotten it within New Mexico. So, we'll hope that this doesn't become a big thing, but.
Great. And there's another question in the chat, Miranda, about COVID medication for people without insurance. Can you talk about where they could go?
Yeah, so that one is sort of, it's another somewhat hard one.
Metal corrector, Jody, metal corrector.
My phones are going crazy. So the medication itself, you should not be charged for. It's again, federally purchased and given to the pharmacies through federal channels. The problem is you can't get treated you can't get the medicine unless you have a prescription. And so that's where the cost comes in. And I think the best bets at this time are probably FQHCs, which will see uninsured people on a sliding scale, and usually at pretty low cost for something like this. And it is reminding me that I haven't actually followed up with the Medicaid people on whether they succeeded in getting Medicaid or treatment added to the that special COVID Medicaid. So let me write that down and find out for our next meeting.
Oh, we have another one in the chat, or a couple more. Any relationship between monkeypox and working as farmers or working with animals?
So good question. In the US, no. So there, I don't know much about cowpox, but there is a thing called cowpox, and it is related to monkeypox and smallpox. And the cowpox is how they actually, like the first vaccine was developed, because someone noticed like, hey, people who work with cows and are exposed to cowpox don't actually get smallpox, which at the time was, a deadly, well, still a deadly disease. We just don't have any of it around. So in the animals that, so again, as part of the guidance of the CDC, just because we don't know, they do say like, if you have monkeypox, be careful with any pets because no one knows for sure if they can get them. But in Africa, definitely animals carry monkeypox. And actually, it doesn't seem like monkeys do, but other animals do. So yes, like many viruses, it can kind of go between populations.
Can I ask another question?
Sure.
This is Claudia from Salud Morena. They asked me this question on Monday, whatever day is today. I think it was Monday or Sunday. I was working I went to do some visits over here in Moriarty area, and they actually asked me if it's any way that I can provide any kind of information where to find it. And I Google and I start to looking in the CDC website, but I wasn't able to find much. And I want to go back to these farmers and give them the information or teach them where they can find this information. Where do you think I can get some of this information?
And this is monkeypox, right?
Yes.
Yeah. I would, so we could either, and actually I should ask Lisa, I think we could email you probably the PDF from our website, but the DOH website has less information than CDC, but it's also kind of all in one place. So we could give you the link. Well, the link is in the slides, so, but we can put it in the chat and see if that sort of seems like enough information. I actually do have a flyer on pets and monkeypox. Let me try and find that because we could send that your way as well.
Yes, please, because that's something that they were talking about working with in the milk farms or lecherias. I have some friends from Hatch that actually ask if I can get some information from there. And if please, if you don't mind, if you can, or maybe everyone will be a good idea to send it to everyone. But if I can, please send me some information because it's a lot of tales. I think a lot of, and I don't know. I don't know if it's a misinformation or not, but it's related. And some people will just start showing some concerns.
Right.
Thank you.
Okay, yeah, we will try and find some sort of, I agree. I mean, the CDC, it's like great, it has lots of information, but it is so hard. I mean, there's so many days I Google something, I read it, and then next day I try to get back to it and I can't find it. So it is a little overwhelming, but I think we can kind of get a few pieces, at least start with a few flyers and see how that works. I think the one on the on our website is also English and Spanish. One of the things is it is a lot of the messaging is geared towards the community of men who have sex with men, because that is kind of the majority of patients who have gotten it in the US. But that doesn't mean they're the, other people can't get it. So we'll just do a little looking for something that more answers your questions. All right.
Great. And Ife, do you want to go?
Sorry, my microphone would not open up. So I have 3 questions because when I hear something like this, it reminds me of the 70s and HIV. And really, we kind of sentenced people to death because we said only one population was susceptible. And you did say, if I heard you correctly, that the spread to others at sometimes the general population is a possibility. And I think about, okay, so you have a friend or someone or even a husband or a wife that's having sex outside of the marriage, you don't know about it. That person's with somebody who had monkeypox, and the next thing you know, everybody's got monkeypox, and now it's not spreading just for the men who have sex with men. So do you think, or have you read anything that would tell us when is this likely to start spreading to the general population? And the second part of that is blood products or transfusions. How does that look? Is it in the blood once you've had it? Can it be spread that way? The other thing is, if you've had, since it's like smallpox, if you've had the smallpox shot, or you've had smallpox, and people are old enough to have had that, are you less susceptible, or it doesn't matter?
All great questions. Okay, I'm work backwards. On the smallpox, it is an interesting question, and CDC basically says they're not sure. I have noticed so, you know, in trying to understand this better, for anyone who's had, who tests positive for monkeypox, the CDC does ask us to fill out a de-identified, but still some clinical information. And one of the questions on there is, you know, has the person had a smallpox vaccine? So I think they are trying to figure out that very question. But as of right now, they're sort of saying like, it's likely that maybe prior smallpox vaccine, sort of, you get a less, I mean, kind of like with COVID, you don't get quite as bad an outbreak of monkeypox, but it does seem that some people have still gotten monkeypox with prior vaccination. But they are closely related, those two vaccines and the two viruses. On the blood transfusions, it's a great question. I'm not 100% sure. Like most viruses, you know, it's a you know, kind of a 3-4 week window that you might have virus, and most people are supposed to be quarantined or feeling yucky. So hopefully they aren't going and donating blood in that time, but I will find out more information about that and let you know.
Okay.
And then, shoot, I feel like there was another question in there that.
There's the jump to the regular general population.
Yeah. I don't know the answer to that. I think, you know, there are medications that are, there is a medication, I should say, that's getting used for treatment, and hoping that really shortens like the viral shedding. And there's also vaccination for people who've been exposed. And then there's the, you know, the contact tracing and case identification. So I think CDC is hoping that, you know, it will kind of peak and come down before it really becomes widespread. You know, I guess they're kind of watching Europe, that was ahead of us, and there's some suggestion that it might be, you know, cases are trending down at this point. And definitely there are people who, you know, already who have gotten it, who are not men who have sex with men. I think the way I think about it is that it's just, you know, anyone who's having that close physical contact with someone with monkeypox can get it. But it happens to have, you know, kind of started in a community, and sorry. And my phone's ringing. Yeah.
So would you say that if somebody has had monkeypox, you should advise them to go and have the vaccine so that the shedding will be less?
So if you have monkeypox, then you're not eligible for vaccine, because again, your body's already making those antibodies. But seek out treatment. And again, everyone who tests positive for monkeypox will get called by the Department of Health. So we will discuss these things with them. And again, only 6 cases in New Mexico. So we're talking a pretty small number. For vaccine, it's if you've been exposed. And again, the kind of a common, or nothing's really common, but a scenario we've had is a healthcare worker that goes in, doesn't realize it's monkeypox, talks to the patient for a while, does an exam, and then the patient's like, hey, what do you think about this? Tests, and it's positive for monkeypox. That it's still pretty low risk, but though exposures like that are being offered vaccines so that they don't develop monkeypox. And hoping that that also helps sort of contain the spread. So same with sexual partners. If if a sexual partner called and said, hey, I just tested positive for monkeypox, then that contact would be eligible for vaccine. And sometimes
Okay.
it stops it from happening altogether, and sometimes it just makes a less bad case. Yeah. And sometimes the
Thank
person
you.
wasn't going to get it at all, but now they're vaccinated.
Oh, thank you, Dr. Miranda. That
Yeah.
explains a lot. And if you can get the information about the blood products and transfusions, because a lot of people that I deal with who are autoimmune compromised or have any kind of a transplant situation, when I'm at the doctor with them, they always ask them, well, are you okay with having transfusions or with having blood products? And sometimes they're very hesitant, and lately more so, because you don't know, what's in the blood. So.
Yeah, thank you for those questions. And I think once we get that information, we'll just send it out to everyone so everyone can have that information and the animal information too. We have just a couple more questions. I want to make sure we don't miss any. When is it best to take COVID medication?
So the kind of the criteria are, so as soon as possible after a positive test is really the answer. But again, not everyone needs COVID medication. So the kind of target audience for COVID medication is sort of what we're used to hearing, people who are at higher risk for bad outcomes from COVID. So that's, CDC kind of puts that cutoff at 50 and over, and anyone with those underlying medical conditions. So this is not the just the immune compromised. This is the people with diabetes, hypertension, obesity, physical inactivity, rheumatologic conditions, but maybe not on medications for them. It's a pretty wide group. So if you're under 50 and have those conditions, or over 50 with or without them, that's the group that is being recommended for COVID medication. And you can't be the medications, if you're going to be hospitalized, are different than the Paxlovid. So they wouldn't give you Paxlovid in the hospital, or even the monoclonal antibody. So it's two different groups of medication. And then among those medications, it does have to be for the oral within 5 days of the start of symptoms. So that can be kind of tough. If you're in that high risk group, test early and often, and don't kind of go 5 or 6 days later, I wonder if that was COVID, and then test, because then you're going to be out of the window for medication. And then the window for the IV meds is a little bit longer, but still only 7, and then the other one is 10 days.
Great. And when it comes to the Novavax vaccine, is that only for boosters?
No, it's actually not for boosters. It's going to be its own primary series. And at least right now, there's no it's okay to mix and match. But if you're someone who's had a bad reaction to the other, maybe you could never finish the mRNA series because you had an allergic reaction, then you could have Novavax. But they're not saying oh, hey, this is just, why don't you try this new one for your next booster? And I might have forgotten to say that it is 18 and over. And then one thing that does distinguish it from, another thing that distinguishes it from other vaccines is that there aren't any fetal cell lines used in the development, testing, or manufacture of the vaccine. So for people who felt really strongly about that with the mRNA and J&J, this is different in that way.
And another question is, are only those 50 and older eligible for a second booster?
So it's 50 and over, and then those who are immune compromised. So at any age, you know, if you're immune compromised, and then 50 and over, regardless of what your medical situation is.
Good afternoon, everyone. It's good to be here. Thanks for having me. Thank you, Dr. Durham, and thank you, Liesl, and everyone else who helps facilitate this call. I prepared just a brief presentation to go over some training updates from my end of things, working from UNM-CHWI. And I also worked on this in collaboration with Devana from Department of Health, who will follow me and offer some updates from her end of things. And we're also going to each offer some insight into structures we're building for collaboration to better support the work of community health workers moving forward. So I will go ahead and share my screen now. And please just give me a thumbs up if you can see the CHWI DOH training and collaboration update slides. Can you see the slides? If you could just give me a thumbs up, I can't. There we go. Awesome. Thank you so much. So, pardon me. So I think I introduced myself to this call at this point to maybe almost 3 months ago. And so it's not just a stranger talking to you. I want to introduce myself again. My name is Sean Stambaugh, and I'm a training specialist with UNM's Community Health Workers Initiative. I specifically work in the health equity program. And right now our focus is on vaccines, as you know. I was born and raised here in New Mexico. I grew up in the Placitas of 30 years ago, back when it was more like a small hippie kind of community as opposed to more of a suburban kind of area it's become now. And I spent 10 years as a middle and high school teacher here in Albuquerque and also in South Los Angeles, where I went to graduate school. Some of the things I've been working on for this program and to support the community health workers in our program and beyond. I've been working on building some structure, just setting up some background structure, some curriculum and other structure to create a training plan. I've been collecting data and identifying training priorities. I often sit in this call and don't say anything, just listen to the questions and use those to help inform the trainings that I am preparing. I am also, and this is one of the main things I want to highlight for today, is I'm developing collaborative relationships with our partners, particularly right now that focuses on building relationship with the Department of Health, but also working with outside trainers and subject matter experts to get trainings that are offered by people other than just me or other people in our program. And I've been learning a lot from listening to all those conversations. So thank you again. I'm always glad to be a part of your conversations, and I appreciate you letting me eavesdrop on your great questions. Just to give you a little bit more of an idea of what I've been working on, I want to give you a peek behind the curtain, kind of like in The Wizard of Oz. There's all that fantastic stuff going on. And I don't want to say the stuff I'm doing is totally fantastic because you haven't seen much of it yet, but then the curtain is pulled back and it's kind of an illusion, and there's a lot of background machinery that is involved. So to help give an idea of what I've been working on, I do want to show just very briefly the curriculum map that I have been preparing. And this is a very long document that has an overview of all of the trainings, both trainings that have been delivered and trainings that will be delivered. So at the top here, and I won't go through everything, it's way too much, but at the top you can see this was the 4-day community health worker training we offered back in March and the beginning of April. Then if we scroll down a bit, this was the org supervisor training that we held earlier this year. I held a training, an orientation training for our UNM coaches who work with all of our partner orgs. And the real meat and potatoes of what's coming up are these training modules that I'm working on planning in the background. So these are in active development in the planning stages, and they focus on a lot of topics that I've heard a need for. Some of those include stigma. Other examples include things like trauma-informed care or anti-racism training. We're looking at an entire series of motivational interviewing trainings, which some of the org supervisors may be aware. You should have received an invitation for an introduction to motivational interviewing skills for supervisors. It's actually happening tomorrow morning, so I'm looking forward to that. That's what's shown right up here. And then there will be a series of follow-up motivational interviewing trainings offered. Just as a little heads up, I haven't put invitations out yet, but for now, we have tentative dates of September 22nd and October 6th for those more advanced motivational interviewing trainings, and those will be open to supervisors and CHWs alike. Other things I'm working on from things I've heard in this call and other spaces that I have entered in my role are like an outreach, creativity, and social media training. I've heard a need for that. Looking at intersections between COVID and other health equity concerns, stress resilience and self-care trainings, really focusing on some of those parts of being okay in our bodies and our mental states when we're doing this difficult work, and lots of other stuff. So I don't want to dwell too much longer on that. Just so you know, I'm setting up a lot of stuff in the background, and as you can see, there will be more trainings headed your way. It takes a lot of time to sort of build this structure and set things up. And I also want to ensure that my trainings are as relevant and as useful to you as possible, which requires us to get some of our ducks in a row, so to speak, as we set up our programming. The other thing I wanted to share with you is this is very much a work in progress, but the Community Health Workers Initiative, with the help of one of our fabulous team members, Jonique, is building a dashboard. This is very much a work in progress. It is not complete, but the idea is that this would create an online hub to show not only current job openings and information about our team and department, but also an upcoming events list. And the thing I'm most excited about is this calendar space, which will be online, publicly available. Will include the opportunity to post with advance notice upcoming trainings, upcoming outreaches, upcoming opportunities with the Department of Health, like certification fairs or any of those other great things that they offer. And the idea that this would be very approachable, color-coded. Right now, we just have one example event on here, but I'd like to set it up as a one-stop shop where folks can click, register for trainings, open attachments, and see flyers or other information all in the same area. Part of the development of this tool and this dashboard, which we're working really hard to get out as soon as possible, led to an opportunity to increase collaboration between myself, UNM in general, and the Community Health Workers Initiative in general, and the Department of Health in the ways that we support community health workers. And so the way that I view my role in collaborating with DOH with the end goal of supporting community health workers in the state is that moving forward, I want to ensure that any training that is offered through CHWI, whether it's for supervisors or CHWs, has CEUs that are attached and that are gotten out to you in a timely manner. I want to explicitly include all of New Mexico's OCHW, the Office of Community Health Workers, core competencies and trainings. Those are the core competencies you need to be certified and to grow and develop your career. So I definitely want to include those. I see myself as a point of communication and an interface between some of the folks in my program and some of the folks at DOH, especially for training needs. So that's a really kind of a long-winded way to say that I really just want to work on supporting each other and building relationships. Devana and I have spent a fair amount of time at this point in conversation and getting to know each other. And my main takeaway from all of that collaboration so far has been that we have the same goal. And that goal is to support community health workers and those who support them, their supervisors and others involved in our work. You are our bottom line. And so anytime there might be any sort of setback or bureaucracy or things that make collaboration harder between UNM and the Department of Health, it damages what we can provide to you. So Devana and I are committed to working closely together to provide the best support we can for you. And one of the main ways we want to do that in the beginnings of this growing collaboration is to provide that online space I just showed you, that dashboard, and create some collaboration actually there. Provide links to each other's trainings and resources and websites, and really create something that's more approachable and in the same place as you continue to grow and do your work, and also to provide a whole lot more transparency just for how things work and what we are doing, which is a point of part of the point of this update. So with that, I would love to pass it on to Devana. As the last thing I will say is, if you ever have any training questions, anyone in this call, if you ever have any training questions, needs, concerns, or anything else you want to bring up to me, especially about training, please don't hesitate to reach out to me. I will put my email in the chat. And I do understand Spanish very well. So if you want to write me an email in Spanish, then I can probably understand what you're trying to tell me. I'm not great at speaking Spanish. I get nervous. And so it might take me a little while to respond, or I might want to have someone translate just to make sure I fully understand. But English or Spanish, it does not matter. If you have any reason that you feel compelled to reach out to me, please do so. And I just put my email in the chat. And with that, Devana, I will stop sharing and pass it over to you.
Great. Thank you, Sean, for that wonderful presentation. Good afternoon, everybody. It's great to see everybody here today. This important call here, I just wanted to extend a big thank you to UNM-CHWI for really moving forward in this collaborative partnership to support the workforce that is most precious to New Mexico, community health workers. So with that, I'll jump right into my presentation to kind of circle back to and add on to what Sean had presented regarding our training collaborative and providing support to the much needed training that is needed for the workforce. And I believe the last time that I was with you guys in this venue was when Venice was introducing me. So I just wanted to say thank you, Venice, for introducing me to this audience here. Can you guys see my screen?
Yes, we can, Devana.
Okay, great, awesome.
Yes.
Okay, so with the first slide, of course, is just to really stress that we are really embracing our partnership, collaborative partnership with UNM Community Health Workers Initiative, and really developing a future roadmap of community health workers workforce development by strategically collaborating to meet the training needs of the CHWs. So this next slide, I really wanted to share our mission of the Department of Health, which is to ensure health equity. We work with our partners to promote health and well-being and improve health outcomes for all people in New Mexico. Our goals for the department is to expand equitable access to services for all New Mexicans, as well as improve health outcomes for all New Mexicans. We also ensure safety in our New Mexico healthcare environments, as well as supporting each other by promoting an environment of mutual trust, respect, open communication, and needed resources for staff to serve New Mexicans and to grow and reach their professional goals.
Devana, I'm really sorry to interrupt, and I don't know if others are experiencing this, but I think your slides froze, and you might want to try, again, in the spirit of collaboration, I'm trying to get your back a little bit here. There, okay, yeah, they unstuck right when you did that. Maybe just try sharing again so we can see them.
Try again. Let me do it this way, and I'll just kind of go through the slides within this format.
Perfect, thank you. Sorry for interrupting, Devana.
Oh no, not a problem. Not a problem. Give me a break. So with this slide, I really wanted to introduce our renewed vision and mission for the Office of Community Health Workers. we're really focusing on supporting the workforce, and our vision is a sustainable, unified, thriving, and well-trained CHW workforce in New Mexico. Our vision for the Office of Community Health Workers exists to support the community health worker profession by providing workforce development, training opportunities, and certification by leading strategic partnerships and capacity building initiatives such as with NMDOH-CHWI and other important stakeholders within the state as well. The next slide will just go over key activities for the Office of Community Health Workers with our renewed vision and mission. The first one is our office seeks to become literally a statewide convener by developing strategic partnerships across New Mexico with organizations employing, training, and mentoring CHWs or advocating for CHWs with the overall goal to support the profession and workforce development. Number 2 and 3 are the two key priorities that we'll be really focusing on today. Number 2 is a customer-centered use of technology by increasing access to trainings through investing in an online training platform and our ability to evaluate the impact of CHWs. A statewide CHW digital hub for CHWs as well as affiliated organizations, and a statewide data collection platform to further and elevate the CHW profession. Number 3 is to increase and expand the New Mexico Department of Health CHW's workforce. And this is particularly in our own department to hire and increase access to healthcare and social services for New Mexico populations. The fourth one is to really cultivate and provide a conducive work environment and develop a safe and exciting organizational culture that promotes teamwork and collaboration by developing annual work plans of the office, clarifying objectives and roles, investing in professional development for the team, and incorporating restorative practices. The next slide, we'll be talking about the online training platform that we're envisioning that will really benefit and address the training needs of the workforce in New Mexico. And again, circling back to the key priority of number 3, which is the customer-centered use of technology, which is in process. And again, to just provide a little more details on this key priority for the Office of Community Health Workers is really to expand technology to increase access to trainings, resources, and evaluate the collective and performance impact of the CHWs by investing in this data sharing platform through the New Mexico Department of Health. And with that in mind, to create and develop an online service hub to provide resource information and assistance to CHW workforce and affiliated organizations. Additionally, to implement an online training portal to localize trainings and provide trainings that other statewide partners offer to the workforce, and just have one centralized location for that. Our deployment date in terms of a timeline is January of next year. We were very hopeful, and we were very confident that we would have been able to deploy this month, but we ran into a slight challenge. But nonetheless, we're resolving that challenge and identifying different resources to ensure that we will deploy this early next year. Train New Mexico is a gateway into the Train Learning Network, which is a comprehensive catalog of public health training opportunities. And this is very important because this platform is free. It's free to CHWs, it's free to affiliated organizations, and it's really a portal that will really provide and localize the trainings, like I mentioned earlier. The Train Learning Network is comprised of Train affiliates, and currently we have 30 state level affiliates and 9 federal affiliates that utilize this Train Learning Network portal. It provides an opportunity for partners to really brand train web portals and have administrative access to the Train platform and work collectively to coordinate and share workforce training efforts. The good thing that we found out, in fact, today, is that Train currently has the capability to issue certificates, but by the end of this year, but definitely for sure in January of next year, the online training portal will have the capability to issue CEUs for any trainings that is provided within this training portal. It also provides a shell, like for example, like if I needed a training that maybe a federal partner, I'm just going to throw this out there, in on the East Coast, was hosting a training, we will be able to offer it through this training portal, and you would not have to go to so many different links. You would get that information in one localized platform, which would be New Mexico Train. Current stakeholders that utilize New Mexico Train include government agencies, academic institutions, and other nationally recognized and respected organizations that post content to the Train Learning Network in order to disseminate and track the trainings to their health workforce. And what I can show you is kind of a snapshot of Train. Let me pull that up quickly. Maybe not that quickly, but so this is Train New Mexico, and of course here's the home page where it talks about courses, training plans, and events. You're able to go into the course catalog and really search courses. Like for example, we have some that are community health workers trainings. That is a web-based training study, which would provide the course number. Of course, the certificate discussion, of course, these tabs would provide additional information, but just wanted to give you a snapshot of the skill level, the amount of time, when it was published, expiration date, and of course, the most importantly is the objectives of the training. And again, for example, this is through North Dakota Public Health Training Network. And so it really is a great online training portal that has great potential to really collectively house training opportunities where you don't have to go all over the place. And it complements what Sean is doing in terms of his efforts with NMDOH-CHWI. I believe that is it. So thank you for having me here. If you have any questions, I'm more than happy to answer to the best ability that I can. Thanks.
Thanks so much, Devonna and Sean. Does anybody have any questions for them while they're here? You can raise your hand or you can put them in the chat. Yeah, Fabiola.
Thank you. I just want to thank you, Sean and Devonna, for putting this up together. It's amazing just to have all that education available for us. It's just amazing. Thank you. And I just want to say that since Devonna got into office, we've been in a roller coaster, learning and experiences new things, all of them good. So I'm really, really grateful for all the work that you put in up for us. Thank you. Thank you.
Thank you, Fabiola. Thank you.
Anybody else have any comments or questions? Yeah, Maria.
Yes, I just wanted to say also thank you to Devonna and Sean. And for us, the promotoras, we need to take advantage of this program. Don't let it slide. Everything's on our hands now. So all the trainings are going to be for us to use in our own times. So let's do this, girls. Sometimes we say, well, we don't have trainings for this and that. No, now everything's on our hands, on our computers. So come on. We need to get together and we need to use this portal. They worked so hard for us. So we need to show that we really are very pleased that they're taking us in consideration for all the work that we do. So we have to show them that this is really needed for us. And they're doing a lot for the promotoras, so come on. We really need to take advantage. Sometimes we just let it slide and we don't do anything, and we complain and complain, and everything's gonna be on our hands. So there's no more complaining, ladies and gentlemen. So let's get with it, and we'll be ready for this training portal on the 20th for next year. Thank you for your hard work that you do for us. We really appreciate it. Thank you.
Thank you, Mari.
Yes, thank you for the kind words. And I'll speak for myself when I say it's a pleasure. I really enjoy doing this work. So, and with that, yes, please do use the tools, especially if you find them useful. And if you aren't finding them useful, or there's anything else you'd like for us to add or work on, let us know, because we want the tools to be useful. We don't want to spend a lot of time putting something together and then have you use it because you feel like you are obligated to use it. We want you to use it because it is useful. And now I'm saying we, so Devana, I hope it's okay that I'm including you in that, but I feel like I can speak to that for both of us, that our bottom line is supporting you. And so yes, use it if it's useful. And if it's not, reach out to us, let us know. We'll make the changes we can and need to.